Hey everyone, it's Moy, and welcome back to today's video about massaging the tibialis anterior. But before we get into the nitty-gritty of the techniques, let's take a moment to understand the anatomy. The tibialis anterior originates from the upper 2/3 of the lateral surface of the tibia and inserts into the first metatarsal and the medial cuneiform bones. Its primary function responsible for dorsiflexion and inverting the foot, essential for movements and activities like running, jumping, and walking. Now, here's the kicker. The muscles can be a real pain for athletes, often leading to pesky shin splints. But don't fret, I've got your back. In today's video, we'll explore some effective massage techniques to help ease tension and treat the tibialis anterior. So let's dive right in and get those muscles feeling good again. I won't dwell too long on warming since I trust you all know what to do. But as a quick reminder, it's incredibly beneficial to explore some ankle range of motion and assess the length of the tibialis anterior prior to treatment. This way, we can have a measurable result post-treatment. One of the most commonly overlooked aspects of the tibialis anterior is the lower half where it transitions into tendinous tissue. Here, the superior and inferior retinaculum act like a secure strap, holding it down. Many therapists tend to skip this part, but not anymore. Starting today, we'll be giving this area the attention it deserves. To start, begin by gently plantar flexing the ankle to lengthen the tib. Glide your palm along the natural curve of the ankle, ensuring broad contact with the palm and repetitive motions to generate heat. Don't hesitate to apply some pressure in this area, that's why we're using the palm. To clearly identify the tibialis anterior tendon, have your patient dorsiflex their foot. It's usually quite obvious as the most pronounced tendon. Now let's talk about addressing the retinaculum. Begin by placing the bolster under the ankle to enhance ankle mobility. Utilize the medial side of your thumb, not the tip, taking note of the numerous bony landmarks in this area. Create some slack in the muscle by dorsiflexing the foot, pushing the ball of the foot and gripping the toes. Pin the superior retinaculum and stretch the area by plantar flexing the foot, using your fingers over the toes to drive downwards. Repeat as necessary. And while you're at it, you can sneak in a calf stretch. Support the ankle at the top with both hands and lean your body weight into the ball of the foot. Moving on. While we're discussing stretching, use your right hand to support the calcaneus. Plantar flex the ankle straight down with your hands positioned over the toes. Hold the stretch for anywhere from 10 to 30 seconds. Alternatively, you can add a slight inversion of the foot for a more dynamic approach. Before transitioning into each variation, reset the stretch with some dorsiflexion. It's crucial to maintain open communication with your patient about comfort throughout the process. Why did the tibialis anterior become a massage therapist? Because it heard there were some great tips for stripping. Get it?
Oh, brother, this guy stinks!
Let's talk about stripping the tibialis anterior. Begin by slightly inverting the foot, creating some internal rotation of the leg, which grants you better access to the tibialis anterior. If the patient experiences discomfort at the foot, adjust your grip at the ankle accordingly. Where the tibialis anterior is more tendinous, use the pad of your thumb until you reach the muscle belly. Then transition to the tip for a more precise edge. For patients with shin splints, this can be quite intense, so ensure the area is appropriately warm before applying pressure. Once you reach the origin, extend the pressure past the knee, easing up as you make a full stroke around the kneecap and patella for a nice finishing touch. Repeat as needed. For a second variation, let's work from proximal to distal, starting at the origin. Apply pressure with your right thumb, using your second hand to add pressure over the thumb through the palm while simultaneously creating internal rotation of the leg with the pressure. Don't miss any chances to incorporate additional work. Where the fingers of the right hand are, you can gently press them into the calf group, sneaking in some extra work. Remember to soften the pressure when you reach more tendinous areas. However, at this point in the video, it might be appropriate to mention that I would absolutely love if you would subscribe to the channel. But I only want you to do so if it feels like I've earned your subscription. If you don't want to subscribe, that's totally fine. I'll catch you in another video. But if you found anything helpful in this video, give some support to the like button for me. Anyways, enough about that, let's get back to the techniques. The same principles apply as before, but with a different tool. I always encourage you to explore what best fits for you and your patient. The key principles of this technique involves applying pressure with the knuckles of the index finger and middle finger. Position yourself so that the right arm is completely straight. Utilize the power of the stroke with your body, not your arms. Move with precision and steadiness, as there are numerous bony landmarks in this area. It's challenging to maintain control over the stroke when the skin is overly lubricated, so ensure it's properly set before diving in deep. This technique can also be performed from proximal to distal, but the crucial aspect is to switch arms and support the knee. This method proves highly effective when the most medial knuckle, particularly the index knuckle, is positioned as close to the shin or tibia as possible. Make sure the pressure is directed downwards, not medially towards the shin. Introducing the cross-fiber stripping technique, featuring both passive and active versions for this maximum effectiveness. Begin at the origin by pressing both thumbs down, creating a V shape between the shin and the tibia. Hug the shin as closely as possible, moving from medial to lateral. Eventually, you'll detect a distinct strum, indicating you've reached the soleus muscle, a convenient opportunity to incorporate additional work. This technique can be quite sensitive for many patients due to acute pressure of the thumbs. Progress down the leg incrementally, pausing when you no longer feel the muscle belly beneath your thumbs. Rinse and repeat. Now, moving on to the active version of this technique. I always encourage therapists to actively involve their patients, as it provides a perfect opportunity for education and emphasizes that this is a collaborative effort. Apply the same principles as before, anchoring to a fixed position. Ask your patients to internally rotate the whole leg while you keep your thumbs stationary, traversing the entire length of the tib laterally. You can prompt your patient to return to the start position once your thumbs have reached the soleus. Progress down the leg 1 inch at a time. As the tib becomes more tendinous, transition to using one thumb due to the reduced surface area and lesser force required. Lots of bony landmarks here. Now let's move on to one of my absolutely favorite techniques. Starting with the passive version first. Grab the top of the foot as if you were throttling a boat. There's no right or wrong way to grip. Explore what best works for you and your patient, as there are plenty of options on the foot and ankle. Begin by dorsiflexing the foot to shorten the muscle, then pin the muscle down starting at the origin, creating the pin and stretch effect by plantar flexing the foot. Repeat this process, typically working from proximal to distal. Remind your patient to play dead and allow you to provide all the movement for them. Now, for those patients who struggle to relax, a more active version of the technique might be more productive. Begin by positioning the leg at a 45-degree angle off the table. Instruct your patient to dorsiflex the foot while you apply a generous amount of pressure. Then have them plantar flex the ankle. The pressure should be maintained throughout the entire movement, relaxing as your patient returns to the start position. Progressing half or 1 inch at a time down the tibialis anterior. Note that the patient who curls their toes too hard might experience a cramping in the arch of the foot during this technique, so give them a heads up beforehand. Let's move on. Rarely do I ever receive a massage with someone using their elbows on my tibialis anterior. You shouldn't be afraid to apply pressure in this area as long as you got your anatomy down on lock. That's why I find it crucial to a good massage, because you're not guessing. Begin by internally rotating the leg at the ankle to improve access to the tibialis anterior. Start with light pressure distal of the ulna, slowly working your way proximally into the area of the ulna 1 to 1.5 inches below the olecranon. Once you've reached the muscle belly, then deliver the necessary pressure. Remember not to over lubricate when using the elbow, as it can feel kinda like a slip and slide and you're working in a really narrow area. You don't want to run the risk of smashing into bony landmarks, cause that sucks. Just as massage brings warmth and rejuvenation, may this video brighten your day and leave you feeling renewed. If you enjoyed it, consider subscribing for more content. And if you found value in it, give it a thumbs up. Sending much love and peace your way. Bye.